get 30 minutes more. I know well. But we cover these topics. We cover this minute in our lecture session. Okay. Today we are going to start a new topic that is called nutrition. Okay. As we already know, in the healthcare, there is nutritionist, dietitians is always present. You know, in every medical college, in every civil hospital, in every major hospitals, there is dietitian is clearly present who tell about the diet. But next slide. This tell about the diet and other things. But before knowing that, you have to know the what is the meaning of diet. Why we take food, what is why we are going to study this nutrition. Okay? You such like seen if we going for overnutrition of the diet, overnutrition of the food component, then we are suffer from several many disease. Then we are going for several many disease like coronary artery disease, okay, diabetes mellitus, hypertension, okay, PCOD and PCOS. Atherosclerosis, AMI, if we are not treated, that is finally cardiac arrest or heart attack. Or heart attack. Okay. If we are taking the diet in overnutrition, if we are going for overnutrition, then we suffer from such kind of disease and disorders. Okay. And if we are going undernutrition, we are taking less amount of balanced diet, less amount of a special component, then we suffer from many diseases. Okay, protein energy malnutrition and nutrition and some kind of disease related with particular or fat. Okay, this is related with that in overnutrition, that is called obesity. Okay, so to understand this all about the nutrition, we go for qualitative and quantitative analysis of food which is present in our diet. But before to understand all of these things, we know what are the meaning of particular things, such like nutrition. What is nutrition? The science deals nutrition, quantitative and qualitative study analysis of different component of diet, different component of food and their nutritional importance in maintaining normal growth function and optimum health of the body. Okay. Different component of the diet means, either it is in the diet there is a presence of protein, there is a presence of fat, there is a presence of carbohydrate. Okay. How the diet is formed? Which diet you call balanced diet? A diet which contain a good proportionate of carbohydrate, protein, fat, vitamins, minerals, and exclusive one important thing, water. Okay, that is called balanced diet. In today's era, you know, in every social networking there is a one more important subject is running on, that is called obesity. How we lose our weight. How we lose our weight. If you know the nutrition, if you know the biological importance of particular food, if you know the quality of the food, if you know the quantitative component of the food, then you easily making the diet chart for yourself and easily drop out your weight. But this is other thing than this. But you understand nutrition and nutrients, both the terms are different. If somebody is asking what is nutrition, it is a science deal with the quantitative and qualitative estimation of different food components, their nutrition value, and how they help for maintaining normal growth, body function, and optimal health of the body. Okay? You listen one quote also, health is wealth. Health is wealth. But how you maintain the health? By proper nutrition, by proper diet, by proper balanced diet. Okay? But you know at least what is the meaning of diet, what is the meaning of nutrition, and what is nutrient? A nutrient is a chemical substance in a food that help maintain the body, some body energy, and build cells and tissue, regulate body process. No single supply, all food nutrients to the body. Okay? That is particularly a chemical substance. Such like we take the example, vitamin B complex. Vitamin B complex. Mineral iron. Mineral calcium. All these are what? These are nutrients. Okay? Because they perform several processes to maintain the body, some body energy, to build up cell and cell tissues, proteins. Okay? So this is to be called nutrients. Okay? Now diet. What is diet? Next question comes in the nutrition, that is a diet. Which kind of diet we take? If we take more carbohydrate, less protein, then there is less formation of the muscles. If you are athletes, what do you need more? You know you need proteins in extra amounts. Okay. If you are hypertensive patient, if you are a cardiac patient, then your diet chart is different. If you are pregnant, then diet chart is different, because in these conditions, these conditions required more energy in different forms. Okay? So first to understand what is the meaning of diet. A diet consists of high energy, high yielding. Energy yielding means we talk about carbohydrate, bodybuilding, protein, and protective nutrients such like vitamin K, iron, folic acid, and B complex, which we eat to maintain normal growth, function, and optimum health of the body. Okay? This is called diet. Simply, if I will talk about the diet, it contains carbohydrate. You already know the function of carbohydrate because it is a major source of the body, major energy source of the body. In carbohydrate, whether you take polysaccharide, whether you take homosaccharides, whether you take starch, it doesn't matter that your diet contains carbohydrate, your diet contains protein, for formations of the body muscles, for growth of the body. Fat, okay, we have different fats. We have good fats, we have bad fats. If we take fats in excess amount, that ultimately it increases body weight, which is not good. Okay, then vitamins and mineral. All the topic we already complete in the class, that every nutrients have their specific value. Okay, carbohydrate, protein, fats, vitamins and minerals. Okay, by composition of all these important plus water. Water is very important. It's make a diet. Okay. If we take this proportionate in a good proportion, it is called balanced diet. It is called balanced diet. Okay. If we change the concept of the diet according to the subject, according to the patient, according to the person, then it is called customized diet. For a heart person, what I need? I need non-oily food. I need less fat diet. If I highly obese, which kind of diet you prefer? Which kind of diet you prefer? That is having less fat plus less carbohydrate, more energy components. Okay, if I will suffer from protein energy malnutrition, what kind of diet you prefer? That in the diet they contain more energy components. Okay, so this is called customized diet according to the person to person. But you first understand the diet which contain all these essential amounts. Okay, and for maintain optimal health of the body. Here we talk about a diet for a normal person. Okay, it's provide energy for physical activity, physiological and metabolic functions. You already know all these things. Where ATP is formed, where ATP is required, in which metabolic pathway ATP is required. You already know because we complete all these important aspects of biochemistry. Understand? We complete carbohydrate of glucose, we complete carbohydrate of galactose, we complete carbohydrate of fructose, we complete carbohydrate of amino acid, we complete carbohydrate of lipoproteins, fats molecules. Okay, so you easily know which for what here if we talk about biochemical aspects, why we require diet. We require for our metabolic functions, okay, for other physical and physiological activities, to provide raw material for growth of the body, repair, okay, to provide essential molecules to maintain the body heat or body temperature. Understand? So by the diet, what we take? We take energy, we take a calorific values. Okay. Now these are the component of the diet: vitamins, minerals, water, proteins and carbohydrates. All these are the component of the diet which is always present in your diet chart. Okay. Now balanced diet. Here the terms is come balanced diet. What do you understand by balanced diet? Anybody can tell? Just raise your hands, give the concept. Anybody? The definition is given in front of you. You will tell it. It is the topic of your class 9th in the science book, CBSE book. It is already given. Balanced diet. This concept government is spread all over the countries, in rural areas also. You understand the meaning of the protein. You understand which food is good, which food is bad. Understand? So balanced diet is what? A diet is to be said balanced diet when it contains all the nutrients in proper portion and quantity according to their RDA. RDA means recommended dietary allowances. Write the full form: recommend dietary allowance. okay, to meet the energy and other nutrition required of the body, requirement of the body. Here we talk about requirement of the body. If I will not suffer from a disease, I am a normal person. So what kind of diet I will take? A normal balanced diet, a normal proportion. If I will having any kind of disease or disorder, then I change the proportions. Then I will change the diet, and this is called customized diet. Okay? But balanced diet is what? It contains all essential nutrients. Nutrients you already know. Okay? In proper portion and quantity. In proper portion and quantity to maintain different body needs, body energies. Okay? Here we not talk about a particular food component. Here we are not talk about particular food component. Here we directly say it is a nutrients. What is that? Nutrients. Okay. Here we not directly say it is carbohydrate, it is protein, it is fats. We are not talking like that. We just simply say it is a nutrition. Okay. Human nutrition can be divided into three major categories: undernutrition, ideal nutrition, and overnutrition. Okay. Now you understand that composition of balanced diet. Okay. This is a diet component for a male of 70 kg body weight. What is required in their diet? If a person is non-vegetarian, how many all of you are non-vegetarian? How many are vegetarian? Vegetarian only 1, 2, 3. Very good. Okay. So we divide our child according to their, don't talk, we divide our child according to the need. The first one is non-vegetarian and vegetarian. Here you see, in non-vegetarian, we take major quantity of meat and fish, egg. It is 30 gram, 30 gram. Okay. In vegetarian, you will see there is pulses is 80 gram. Pulses is 80 gram. What does that mean? What does that mean? That means we accomplished the requirement of protein by pulses. We accomplished the requirement of the protein by taking pulses in vegetarian diet. These all are the quantities: 470, 125, 75 gram, 100, 30, 200 in gram. Okay? It is in gram. Okay? So these are the components of the diet. It is called balanced diet. It is for normal person. These components are present in it. Okay? Now calorific value. Here we complete nutrition, nutrients, and diet and balanced diet. What are the meaning of that? Now calorific value of carbohydrate, fats, and proteins. These are the calorific value: 4.1, 4.0 per gram. It is per gram. Fats 9.4, protein 5.4. In our body, it is 4.0, 9.0, 4.0. But you see that if we take, there is in outside the body, they produce 5.4 calorie. Okay. But in our body, it produces 4.0. So there is some other concept which is called SDA, specific dynamic actions. Okay. We understand it. Okay. Now calorific value, what is the meaning of calorific value? You already know the amount of heat energy produced on complete oxidation of 1 gram of nutrient. 1 gram of nutrients. All things are calorie. All things are basically calorie. How much calorie intake? I will take 1897 calorie. If a person is hard worker like labor, if a person is, calorie means amount of heat generation produced by complete oxidation of 1 gram of nutrients. Okay. Now you will see minerals and vitamins do not yield energy, therefore they have no calorific values. So how these minerals and vitamins help? How these minerals and vitamins help for optimal growth of the body? Yeah, definitely. Vitamins play a role for different metabolic pathway, act as a coenzyme. Okay, and minerals are very important for doing other important aspects of the biochemistry. Okay, like formation of hemoglobin. Which mineral is required? Iron. Okay, for carbonic anhydrase enzyme. Which minerals is required? Zinc. Okay, so all these are small things and big concept. Now energy requirement of the body, it depends upon three processes: basal metabolic rate, thermogenic action of the food which we call SDA, and physical activity. That is very important concept, and these questions asked in different ways, in brief answer questioning, in short answer questioning, such kind of questions. Okay, now we complete basal metabolic rate. What is the meaning of basal metabolic rate? That is, BMR is defined as minimum amount of energy required by body to maintain life at complete physical and mental rest. It is the post-operative state. It may also denote as resting metabolic rate. Just to understand, our body needs energy. Our body needs energy in different aspects, in different physical activity. Okay, our body needs also in sleeping, needs energy in sleeping, for respiration, for heart rhythms, for different organ functionings. We required energy. Okay, but when we are in complete rest, we are not doing any hard physical work. When you are in complete rest, at the time of sleeping, the requirement of energy referred as BMR. It is called basal metabolic rate. Basal metabolic rate. Simply, if somebody knows the definition, he easily says it is the minimum amount of energy required to maintain life at complete physical and mental rest. पोंगसुक बांगड़ू का नाम सुना है? A scientist from Ladakh. In latestly, he is going to starvation. भूख हड़ताल कर रहे थे एक अच्छी, prolonged starvation, but he will survive. Why he will survive? Because he is in BMR state. He is not taking nothing. He is always sleeping. So all these are related with calorific values. Okay. You understand? Minimum amount of energy required to maintain body life at complete physical and mental rest. It is a post-operative state. It may also denote as resting metabolic states. Okay. So normal value of BMR is 35 to 38 calorie square meter per hour. Calorie square meter per hour. Okay. And adult movements required 32 calorie square meter per hour. So there is some calculative formula for that. How will you calculate it? How will you calculate BMR? It is by height upon weight, height in centimeter upon weight. Okay, we calculate the BMR. Let us see, I will give the formula here. This formula is for BMR, it is height in centimeter upon weight. Okay, height upon weight. This is the BMR. BMR basically we use BMR to calculate the energy requirement for a particular person. Okay, you will see these are the factors which can affect BMR: surface area, sex, age, physical activity, hormones, environment, and some starvation, fever, and disease states. Okay, such like in the case of fever, BMR is high. Why? Because in fever, body temperature is high. In the case of surface area, if a person is more obese, more heavyweight, their BMR is less. So all of you see this the factor. All of these are the factors which can affect the BMR. Okay. Now SDA is specific dynamic action. It is very important. Directly go to the definition of these terms. The phenomena of extra heat production by the body over and above the calculated caloric value. When a food is metabolized by the body, it is known as specific dynamic action. It is also as calorigenic action or thermogenic action. I simply simplified this definition. If I will take carbohydrate, it is metabolized. It's not required excess energy. If I will take protein, if I will take 100 gram of protein, simply 100 gram of protein, then protein metabolized 70 gram and 30 gram protein energy is used to metabolize 100 gram of proteins. This is called SDA. You simply see over and above the calculated caloric value. Understand? Over and above the calculated caloric value, it is called SDA. It is called specific dynamic actions. SDA for proteins, fats and carbohydrates are 30%, 13% and 5%. Okay? Means, what is the meaning of that? That simply means if you want to metabolize 1 gram of protein, it required 30% energy. Simply not. It is like if we metabolize 100 gram of proteins, it will take 30% energy for metabolization process. Fats 13%, carbohydrate 5%. So which one is easily metabolized? Carbohydrate. That's why it is called primary source of energies. Primary source of energies. Understand? This is called SDA. You understand this SDA? This question comes in your exam in short answering questioning. That is 2-mark questions. Okay. Now, energy requirement for men. Here we talk about the requirement of energy in different label, that is called moderate work, heavy work, very heavy work. Moderate work for a person who is like doctors, who is sitting in the chair in the day, teachers who are not doing hard working. Heavy worker such like carpenter, okay, painter, a person who is doing a glass work, architecture, these all are considered heavy work. The requirement is different. For moderate work, 25000 to 2900. Okay, calorie per day. These are the requirements. 2900 to 3500 for heavy work. For very heavy work, just like a working rickshaw pulling person. Okay, such like a labor who is working in civil field. These are heavy workers. They require more energy, 35000 to 4000 calorie per day. These require highest energy requirement because their body needs the energy for their physical work. I directly say diet is divided by the physical health, physical states. Okay, here we talk about the calorie. Directly we make the concept of the calorie, how the calorie is required. It is divided by the working of the person. It is moderate work, heavy work, very heavy work. Understand? Now you will see calorie requirement including BMR for various kind of physical activity in adults. What we are doing for extra working for burning more calorie. Just like in sleep, there is 60 kilocalories burned per hour. How much? 60. Take the snap of this slide. It is very important. Sitting at rest, 90 kilocalories. So many of the students say, sir, कुछ नहीं करना, energy तो जा ही रही है. We are sitting at the chair. There is energy is also expenditure. On standing, 100 calorie. Walking up stairs, that is important. Walking up stairs, that's required 1000 kilocalorie. Walking slow, 200 kilocalorie. For carpentry, 200 kilocalorie. Swimming, 600 kilocalorie. Painting, 150 kilocalorie. Walking, 300 kilocalorie. So in different physical working, we require different calories. Understand? Now daily requirements of male and females, you understand? Light and sedentary work 2400, moderate work 300, heavy work. I easily divided before this slide. We divide the calorific value according to the person of the working person. Now you see for adult male, in adult female, you will see normally what is required 2000 kilocalorie in normal female, but in pregnancy it is 2300 kilocalorie. Matlab it needs more energy because their physical states is different. That's why you will see the RD of the vitamins is different for pregnancy and lactation women. RDA for minerals of different iron and calcium is increases in pregnant and lactating women. Why? Because they need more energy. Now, nutritional importance of various components of the diet. We start this topic in the next class. I think time is over. Your next class is? Not me. Okay. We start this topic in the next class and we finish this topic. Okay. Here we complete all the important of the diet, why carbohydrate is required, why fat is required, why protein is required, what happens with the related with the diet, and lastly we understand about protein, energy and malnutrition. Thank you.
You have to know the sternocleidomastoid, that is the key muscle in the neck. Okay. So what is the origin? Write it down. Origin is from the sternal head, that is from the sternal head, from the sternum. Okay. Clavicular head. Which end of clavicle? Do you know? Medial end of clavicle. Okay. And what is the peculiarity of this muscle is where it got inserted? In the mastoid process. So where the mastoid process is situated? It is situated just posterior to the ear. Okay. That elevation. So my question is that, is it present at birth? Is this mastoid process is there at the birth or not? No. So when does it develop? Write it down. Mastoid process develops during second year of life, or at the age of 2, by by gradual pulling of sternocleidomastoid. By gradual pulling of sternocleidomastoid. Okay. Now, what about the nerve supply? Nerve supply is spinal accessory nerve. Write it down. It is supplied by spinal accessory nerve. Then what is its function? If you are turning your neck, okay, if you are turning your neck to the side, this action is provided by sternocleidomastoid. Okay, so now if you see the sternocleidomastoid, so it will run downwards, forward, and from the mastoid process to the sternum. Okay, and it will give rise to anterior triangle and posterior triangle. Now we will see what are the boundary. Okay, so see, this is the anterior and posterior triangle. So you could see in the between this muscle is the sternocleidomastoid. Okay, so it is dividing the anterior triangle and posterior triangle. Now the anterior triangle is further divided by another two muscle. Okay, so write it down. Which are the two muscles? Which is going to the mental protuberance, that is the anterior belly of digastric. Okay, so could you tell me what are the muscle of pharyngeal arch? First pharyngeal arch and second pharyngeal arch. Already you have studied in embryology. Which is the nerve for first pharyngeal arch? Could you recall? Which is the nerve for the first pharyngeal arch? Mandibular nerve. Okay, write it down. First pharyngeal arch, the nerve is mandibular nerve from trigeminal. Mandibular branch of trigeminal nerve. Okay, why I am saying it's very much important over here. Okay, and another one is nerve for the second pharyngeal arch. Write it down. Nerve for the second pharyngeal arch. তাহলে পরের নার্ভটা কি হবে? Is the facial nerve. Is the facial nerve. Okay, so why I am saying, see, this is one muscle. It has got two belly. যেটা anteriorly থাকছে, this is anterior belly, which is having posteriorly, this is posterior belly, but it is a hybrid muscle. Okay, so write it down. Anterior belly is supplied by mandibular division of trigeminal nerve, whereas posterior belly is supplied by the facial nerve. Okay, this is very much important. তাহলে একটা কি muscle এটা? Okay, another muscle is omohyoid. Write it down. Another muscle is the omohyoid. Okay, another muscle is omohyoid. So omohyoid, how many belly are there? There are two belly. Okay, write it down. Omohyoid has got two belly, superior belly and inferior belly. So if you see the neck, in between that you could find only one bone. What it is called? Hyoid. So what is the peculiarity of this bone? Is got any other bony attachment? No. So write it down. Hyoid is the exception. Hyoid is the exception where it does not articulate with any other bone. Okay, আমরা কি দেখি? Any joint there is articulation with other bone, but hyoid has got no other bony attachment. So how does it hang? So it is suspended by numerous muscle. Okay, so some are suprahyoid, hanging the hyoid from superiorly, and some are giving support from the inferiorly. So that is the infrahyoid muscle. Okay, so this omohyoid is one of this hyoid muscle. Okay, suprahyoid muscle. Okay, so now you see this is the triangle. Okay, so you could see which is this muscle? That is the sternocleidomastoid, and posterior to that which muscle? That is the trapezius. Okay, that one is the trapezius, and this is the sternocleidomastoid. So how this angle is formed? Write it down. How the angle is formed? First one is the midline from the suprasternal notch. See over here, from the suprasternal notch to the symphysis menti. Write it down. First line from the vertical line vertical line from the suprasternal notch to the symphysis menti. Okay, symphysis menti. Then another border is formed by the which border of sternocleidomastoid, medial or lateral? Sternocleidomastoid is oblique, so which border it is? Medial border. Okay, write it down, medial border of sternocleidomastoid. Okay, and another one is, if you see this whole area, that is symphysis menti to the mastoid process. Okay, so write it down. The base is formed by the inferior surface of mandible. Now we will see this is the suprasternal notch. Okay, from there it is going where? To the symphysis menti. Okay, so now see, it is bounded superiorly by the lower border of mandible, already we told, posteriorly by the anterior border of sternocleidomastoid. Medial border টাকে আমরা anterior border বলতে পারি. Okay, and it is covered by kiki. What are the covering? So this is a roof. Write it down. Roof is formed by skin, superficial fossa. The neck has got deep fossa or not? Yes, neck has got investing layer of deep fossa. Okay, very much important. Okay, so skin, superficial, platysma and the investing layer of deep fossa. So what is the platysma? So what is the peculiarity? It is present on the neck, one of the muscle of the face, head and neck. Okay, but what is the peculiarity? Write it down. It is a subcutaneous muscle. Okay, so it takes origin from the skin. So skin, superficial fossa, then we have got platysma. The next one is the investing layer of the deep cervical fossa. Okay, so this is forming the roof. Now what are the posterior border? Already we have discussed. Anterior border of sternocleidomastoid, base is by the inferior border of mandible. Okay, anteriorly by the anterior midline, which is connecting suprasternal notch to the symphysis menti, and apex. Where does the apex? This anterior line and the anterior border of the sternocleidomastoid. Okay, that is forming the apex. So see how the anterior triangle is further divided into 3.5. Okay, so first one is what you are getting just below this symphysis menti and anterior belly of digastric. Okay, so that is known as mental triangle or submental triangle over here. Then next one is, see this anterior belly of digastric and posterior belly of digastric. So that is also known as digastric triangle. Okay, or it is also known as submandibular triangle, same. Okay, then the third one, most important over here, which side? Lateral or medial side? Lateral side. So that is the carotid triangle. So why it is important? All the important vessels and nerves are going over here. Okay, so tell me, what are the arterial supply for head and neck? Carotid artery. Which carotid artery? So if you could remember the arch of aorta in the heart, it will have how many divisions? 3 divisions. So from medial to lateral, who are they? প্রথমে কে আসবে বল? Brachiocephalic trunk, then left common carotid artery, then left subclavian, right? BCS alphabetically. So these common carotid artery, again further left and right, it will divide into internal and external carotid artery. So what about the external carotid artery? Where does it supply? So the external surface of face and neck. Okay, whatever the viscera, whatever present over there, it would be supplied by that. What about the internal carotid artery? It is going to supply the brain parenchyma. Understood? So this is the artery. What about the vein? Which vein will go? Which jugular? There are 2 jugular veins. Internal jugular vein. Okay, internal jugular vein. Meanwhile, it will supply also the brain. Okay, and additionally, which nerve? Vagus nerve. Okay, additionally, vagus nerve. We will come across the carotid sheath. So see over here, this is the sternocleidomastoid. This is the anterior median line, and base is formed by the inferior surface of mandible. Okay. Now you have to know where it is which is the level for the anterior triangle. Write it down at the vertebral level C3. Okay, at the vertebral level of C3. Okay, and same like the abdomen, anterior wall, we have also got strap muscle over the neck. Which are they? What do you mean by strap muscle? One of the example is rectus abdominis, right? So in rectus abdominis, what you have seen? Numerous layer of the muscle of abdomen joined together form the rectus abdominis, and it is also protecting the anterior abdominal wall. So meanwhile, the anterior surface of the neck is also protected by strap muscle. So which are the strap muscle? Write it down. Which are the strap muscle? So first one is sternohyoid, sternohyoid, sternothyroid, thyrohyoid, thyrohyoid and omohyoid. How you remember this one? TOS. Okay, TOOSS. Okay, so T for thyroid, O for omohyoid, and S for sternothyroid and sternohyoid. Okay, superficial to deep. So now we will come across, these are also known as strap muscle. Make one short note, strap muscle of neck. Okay, it may come. Which are the strap muscle of neck? Okay, so see, these are the 4 muscle I told. Okay, so how it is present one by one layer? First one, sternohyoid. Sternohyoid means ki from the sternum to the hyoid. Then sternothyroid, sternum to the thyroid cartilage. Okay, then the next one is the thyrohyoid. Thyrohyoid means from the thyroid cartilage to the hyoid, and the last one is omohyoid. So we are concerned about omohyoid. I told omohyoid has got 2 belly, superior belly and inferior belly. Okay, so these are the strap muscles. So why these are important? These are protecting the neck. Okay, basically the carotid triangle. And you know, in the anterior side, which are the things are present on the neck? প্রথমে কি আছে বল? Thyroid gland, right? If you see the cricoid and the thyroid cartilage, you have got the thyroid gland. Posterior to that কি আছে? Trachea আছে, right? Posterior to that, and posterior to that কি আছে? Esophagus. Okay, so these are the important viscera that has been protected. So write it down. Which are the suprahyoid muscles? So suprahyoid muscle কি কি আছে? Number 1 is digastric. So you have to say anterior and posterior belly of digastric. Okay. Then the stylohyoid. Stylohyoid. So what is the origin of stylohyoid? কোথা থেকে আসছে বল? Styloid process. Okay. Which is the part of this bone? That is the temporal bone. Temporal bone has got one elongated part, that is known as styloid process. ঠিক আছে, তো ওখান থেকে একটা আসছে from up to the hyoid, so that is stylohyoid. Then next one is the mylohyoid. So mylohyoid টা কোথা থেকে আসছে? Mylo means mandible. Okay, from mandible to the hyoid bone. So these are the 4 suprahyoid muscle. Okay. Then next to that we have got geniohyoid. So geniohyoid is connecting the genio মানে কি tongue. Okay, it is connecting tongue to the hyoid bone. Okay, so these are the, so how many are there? Total 4. Okay, এখানেও তুই দেখ, যদি digastric বলিস, anterior belly is supplied by the mandibular division of trigeminal nerve. Posterior belly is by the that is the facial nerve. Okay, then next one is stylohyoid. একটু nerve supply গুলো লিখে রাখ. Stylohyoid is supplied by facial nerve. And mylohyoid is supplied by mandibular nerve. Mylohyoid is supplied by mandibular nerve. And geniohyoid is supplied by ansa cervicalis. Ansa cervicalis. I will come across. ANSA, ansa cervicalis. Okay. তার মানে একটা দুটো মাসেল পেলাম supplied by facial nerve, একটা হচ্ছে posterior belly of digastric, another one is stylohyoid. Okay. So see, these are the muscle. Okay. So if you see the omohyoid, see how the omohyoid is divided. If you see the sternocleidomastoid, it is crossing the omohyoid in the middle. So that superior is known as superior belly, inferior is known as inferior belly. Okay. And that's why it is creating the triangle. Now, which are the infrahyoid muscle? Write it down, infrahyoid muscle. We have got, already I have discussed, this is the toss. This is also the strap muscle of neck. These are also the strap muscle of neck. So you have got from superficial to deep, first will come sternocleidomastoid. Sternocleidomastoid. তারপরের লেয়ারে কি থাকবে? sternothyroid. তারপরে thyrohyoid, then the omohyoid last. So you have to know superficial to deep. Okay, it will have practical value in the dissection. Okay, from superficial to deep, which are the muscle. So this is the infrahyoid muscle. Now first triangle, that is the digastric triangle. Write it down, digastric triangle. So already I told digastric triangle boundary ki hobe, one boundary is crossed by the mandible, inferior border of mandible. Okay, and another thing is this anterior belly and posterior belly of digastric. So it is creating one triangle. So that is known as digastric triangle. This is also known as, এটা কিন্তু ঘুরিয়ে দিতে পারে, this is also known as submandibular triangle. Both are same. This is also known as submandibular triangle. Okay, now the question is, which are the content? কি থাকে ওর মধ্যে? First one is submandibular gland. There are some lymph nodes, that is also submandibular lymph nodes. So submandibular gland as well as submandibular lymph nodes. Additionally, we are having 3 vessels. Which are they? First one is facial, submental and mylohyoid. Facial, submental and mylohyoid. Okay, and there are 2 nerves. Which are they? Number 1 is hypoglossal, another one is the mylohyoid. Hypoglossal and another one is the mylohyoid. Okay, so what about the hypoglossal? This is the 12th cranial nerve. So where it will supply? It will supply the tongue, muscle of tongue. Okay, so see, these are the boundaries. So first one you are getting, this is the inferior border of mandible, and both sides this is the anterior belly of digastric and posterior belly of digastric. Okay, and below to that, if you see, that is the submental triangle, that towards the laterally, that is the carotid triangle, and towards medially, that is the muscular triangle. Okay, now write it down, most important, carotid triangle. So carotid triangle, which are the boundary? Sternocleidomastoid. Sternocleidomastoid. কোন বর্ডারটা হবে বল? Anterior border. Anterior border of sternocleidomastoid. Okay. Then posterior belly of digastric. Posterior belly of digastric. And another one is superior belly of omohyoid. Superior belly of omohyoid. This is the most important triangle. Okay, so what are the content? Already I told you, common carotid artery and its branches. Ki branch hobe? Internal and external carotid artery. Okay, internal jugular vein, vagus nerve, and additionally you are having internal and external laryngeal nerve and the lymph nodes. এই দুটো কাকে সাপ্লাই করে? ইন্টারনাল এক্সটার্নাল ল্যারিঞ্জিয়াল নার্ভ. ইট উইল সাপ্লাই দ্য হোল ল্যারিংস. ওকে, so this is may comes as short note. Okay, So if you see the carotid triangle, দেখ কি কি তৈরি করছে, anterior border of sternocleidomastoid, then posterior belly of digastric and superior belly of omohyoid. Okay. So now coming to carotid sheath. So just like femoral sheath, this is the deep fossa, condensation of the deep fossa. So that is known as carotid sheath. But in the carotid sheath, you have to know which are the structure. Okay. So medially we have common and internal carotid artery. Medially we have common and internal carotid artery. Okay. Laterally we have internal jugular vein. Laterally we have internal jugular vein. And vagus nerve টা কোথায় থাকে? At the posteriorly. It is present posterior to the carotid sheath or posterior wall of the carotid sheath. These three things is the main component of carotid sheath. Okay, one artery, two artery, internal carotid, common carotid, internal jugular vein, and additionally the vagus nerve. Okay. So see, this is the picture I want to show you. This is the cross section of neck. Okay, transverse section of neck. So if you see the first thing, anteriorly কি দেখতে পাচ্ছিস? There are the strap muscle, যেগুলো পড়লাম এই মাত্র, ঠিক আছে, toss. Then next to it is the thyroid gland. Okay, next to it is the trachea. Okay, then next to it we are having the vertebra. Okay, so where is the presence of carotid sheath? In between the first layer of muscle and posterior layer of muscle. Okay, in between you have carotid sheath. So see, these are the three things we could see: internal jugular vein, then common carotid artery, internal carotid artery, and vagus nerve. Okay, so see, these are the components. Okay, so just like the femoral sheath, it is covering this structure, important structure. Okay, so this thing I will discuss later. Now coming to the submental triangle, write it down, submental triangle. Submental triangle is boundary by the anterior belly of digastric and the body of mandible. Very easy, only the anterior belly of digastric and another one is the body of the mandible. So what would be the content? First one is the anterior jugular vein. So anterior, this external jugular vein would be divided into, I am talking about external jugular vein, which will supply the head neck. Okay, it will divide into anterior and posterior branch and it will make one W like structure. Okay, so তাহলে কোন ব্রাঞ্চে থাকবে? Anterior branch. Okay, anterior jugular vein and also lymph nodes. In lymph nodes you write submental lymph nodes, specifically the submental lymph nodes. Okay, so see, these are the structure that is which are present on the mental triangle. So anterior jugular vein টা দেখতে পাচ্ছিস? Okay, and additionally also the lymph nodes. Now to the muscular triangle. Muscular triangle, which is the structure you are having? That is the sternocleidomastoid, which border again the anterior border and superior belly of omohyoid and midline from the hyoid bone to the jugular notch. Hyoid bone to the jugular notch. So it is present on the midline. Okay, এই সাইডে কি আছে? superior belly of omohyoid আছে, right? And here you are having the sternocleidomastoid oblique line and another midline from the hyoid to the jugular notch. Okay, content কি কি থাকে? Larynx. Okay, larynx and vocal cord anteriorly, thyroid gland and the lymph nodes. These are the content of the muscular triangle. Larynx মানে তো trachea পরে যেটা ইয়ে হচ্ছে larynx. Okay, trachea and larynx. Then you are having pharynx and esophagus posterior to that, but it is not covering that area. Okay, only larynx, thyroid gland and some lymph nodes. Okay, this is the content. See, this is the muscular triangle. So already I told it is covered by this fourth strap muscle or infrahyoid muscle. So this thing you have to know. If you cut the muscular triangle, which are the thing you have to cut? Okay, make one arrow: pretracheal fossa, thyroid membrane, thyroid cartilage, then cricoid ligament and cricoid muscle. Then lastly you are having the trachea. Okay. So see, this is the muscular triangle. Understood? So we are having anterior belly of digastric. So see, these two, all muscle, it is hanging which bone? The hyoid bone. Okay, inferior origin is always from the hyoid. Okay. So from here, which thing will come as a short note? Write it down. First one may comes as, most important is carotid triangle, carotid sheath. Then the strap muscle of neck, suprahyoid muscle and infrahyoid muscle. So you have to always remember, it is divided, anterior triangle is further divided into 3.5, not 4. Which one is half? This submental. Okay. Submental triangle is the half. So that is all about the anterior triangle of neck. Okay. Today go and see the boundaries. Okay. And each and every hyoid muscle, suprahyoid or infrahyoid, you have to remember the origin insertion. We will have the separate class for that one. Okay. Thank you.
So we will demonstrate today is the first one, the most important one, which is spirometry with BDR. Okay, spirometry with BDR, and we have already classified different respiratory diseases or different lung diseases. You know, obstructive diseases, you know, restrictive diseases, and you know, vascular diseases, right? So this spirometry with BDR is nothing to do with vascular diseases. Mainly we focus on obstructive diseases and restrictive diseases, and by now you already know the examples of obstructive diseases like bronchial asthma, like COPD. Under COPD we have two different diagnoses, one is emphysema, another is chronic bronchitis, and there are other obstructive diseases as well like bronchiectasis, like bronchiolitis obliterans, right? And under restrictive we had divided into parenchymal lung lesion and extraparenchymal lung lesion. Under parenchymal lung lesion you have most important diagnosis is IPF, idiopathic pulmonary fibrosis, right? Idiopathic pulmonary fibrosis, and there are other diseases like pneumonia, okay, and occupational lung diseases like silicosis, asbestosis, right? So these are all restrictive lung diseases under parenchymal, and under extraparenchymal you have bony problem, you have muscular problem, and you have neurological problem. Okay, under bony problem you have kyphosis, scoliosis, ankylosing spondylosis, and under you know, muscular problem you have myasthenia gravis, right? These are all restrictions. Okay, and under neuromuscular you have central CNS, you have obstructive sleep apnea, obesity. So these are central problem, right? So all of this, and vascular lung diseases like pulmonary hypertension or pulmonary thromboembolism, right? But we are not focusing on vascular lung diseases because everything what we will do today is focusing on obstructive and restrictive lung disease. And you know little bit of pathophysiology of bronchial asthma, which is due to bronchial smooth muscle hyperresponsiveness, right? Chronic bronchitis is due to hypersecretion of the mucous glands, right? And COPD and emphysema is maybe due to you know, smoking, and it may also be due to alpha-1 antitrypsin deficiency. In case of smoking, it is centri-acinar emphysema, and in case of alpha-1 antitrypsin deficiency, it is pan-acinar emphysema, right? Now, our focus is to diagnose the patient, right? But before performing this pulmonary function test or spirometry with BDR, you have already got some clues from your history and clinical examination. If you have history of smoking, it will go in favor of COPD. If there is history of allergy, it will go in favor of bronchial asthma. If there is a history of occupational exposure, there will be, it will be in the favor of lung fibrosis, right? Okay. If there is any infection, it will go in favor of pneumonia, right? So these are different diagnoses we will focus on, okay? But many a times there are confusions. There are confusions like say for example, a female patient, there is no history of smoking, and it may be there is no history of allergy, right? So you are in a dilemma whether it is bronchial asthma or bronchitis or emphysema. Okay, so in that cases this pulmonary function test or spirometry with BDR is very much useful, right, for the diagnosis of the patient, right? Okay, because you know COPD may occur in non-smoker as well. if there is alpha 1 antitrypsin deficiency, it may happen to anyone because it is a genetic problem, right? So there is no relation with smoking, right? Okay. Now you have already known some dynamic parameters. Okay, static parameters we will not use over here. You know all the static parameters. What is TLC? What is reserve volume? What is functional residual capacity? What is vital capacity? Everything you know, right? And you have already known some dynamic parameters. The dynamic parameters which depends on time. So most important is the FEV1, that is forced expiratory volume in first second. Okay, forced expiratory volume in first second, that is FEV1. Then you have FEV1 divided by FVC. Okay, FEV1 divided by FVC. Next we have PEFR or peak expiratory flow rate. Peak expiratory flow rate, right? Okay, and we have MEFR or mid expiratory flow rate. It is also called FEF 25 to 75. Okay, FEF 25 to 75. Okay. Okay, so now let us know about the device, how to do pulmonary function test or pulmonary function test and spirometry with BDR. So it is a simple computerized machine. So we have a device. So this is the device. Okay, and this device is connected to the machine. Okay, this device is connected to the machine, and the machine is connected to the computer with the help of a USB port, right? USB port, and we have a software over here. Okay, and this machine is capable of measuring the flow. Okay, measuring the flow, the volume. Okay, if I blow inside this machine, right? If I blow inside this machine, the machine will measure the flow, the volume, everything for you, right? Okay, so this is the machine, and let us know about the manufacturer first. There are different manufacturers throughout the world which manufactures this PFT machine, right? So in India, the most popular brand is RMS, BPL. They manufacture this PFT machine, and worldwide, if you talk about MNCs or multinational companies, there are Philips Healthcare, there are GE Healthcare. So they manufacture PFT machines, right? So our device is made up of RMS. Okay, RMS. The model number is Helios 702. Okay, model number is Helios 702. We are using over here. So this machine can be used standalone if we do not attach it to the computer. So what will happen? The machine will give the report in the form of paper strip, just like an ECG machine, right? And if we want any computerized report, we can connect this to the computer and we can print the result, right? And finally, we need to report that. Okay, what is the disease? Okay, what is the disease? Whether it is obstructive or restrictive or mixed or whatever. So there is a report section for you, for the physician to make the report, right? Okay. So before starting, so we have many reports over here because from Santiniketan Medical College and Hospital, the patients whoever is coming with the respiratory distress, we perform PFT over here on particular days. Okay, not every day, but on particular days. So we have kept all the reports of the patient for medical records. One copy is given to the patient and one copy we keep here for our medical record purpose, right? So if we look at one report, okay, so divide it among yourself. Okay, return afterwards because this will be required for medical records. Okay, sample report. So before see here, everyone see here. Okay, so this is a sample report, right? This is a sample report, but the sample report means done only on our patients. Okay, so you see two things. One is the parameters. Okay, one is the parameter. You see first parameter is FVC, then FEV1, then FEV1 by FVC, then FEF 25 to 75, then PEFR, peak expiratory flow rate. Okay, so the first 5 parameters will be required for you and for your diagnostic purpose and for your examination purpose as well. Okay, so look at the first 5 parameters. These are most important for us. Okay, I am not explaining the other parameters, and those parameters will be not required for us right now. Okay, so focus on first 5 parameters: FVC, FEV1, FEV1 by FVC, FEF 25 to 75, and peak expiratory flow rate. Okay, and you see the result, FVC result. One is written in red color, and right side 2 columns are written in blue color. Okay, so red column is for pre-medication. Red column is for pre-medication before taking salbutamol inhaler. Okay, before taking the inhaler, right? So what we will do? This is for BDR or bronchodilator reversibility. Okay, this is for BDR or bronchodilator reversibility. So what the drug is? It is ascaline or salbutamol. It is beta 2 agonist, right? Okay. So you already know from our previous discussion. You already know from our previous discussion how to differentiate between bronchial asthma and COPD, right? How to differentiate between bronchial asthma and COPD. So what we'll do, we'll perform this spirometry and we will check for all the result, FVC, FEV1, FEV1 by FVC, everything, all the parameters we'll note and see the result in red color, right? See the result in red color, and after that, if there is any problem, so I told you that first the parameter which we need to focus on is FEV1 divided by FVC. Okay, first parameter. Okay, आपको ये report दे दिया गया, and the first parameter you will look for is FEV1 by FVC. And if FEV1 by FVC is less than 80%, and remember nowadays it is according to the new respiratory medicine textbook, it is 70%, right? Okay, so for our discussion we are considering is 80%. So FEV1 by FVC, consider it 80%, right? If it is less than 80%, you stamp it, it is obstructive, right? If it is FEV1 by FVC less than 80%, you stamp it obstructive. Okay, now you don't know what is the obstruction. It may be bronchial asthma, it may be bronchitis, it may be emphysema or anything else, right? But it is obstructive, right? And if it is more than is equal to 80%, it is either normal or restrictive, right? So FEV1 by FVC, if FEV1 by FVC is more than 80%, it is either normal or restrictive, but we don't know whether it is normal or restrictive, right? But at least it is not obstructive, right? If it is more than 80%, at least it is not obstructive, correct? Okay, now how to differentiate between your bronchial asthma and COPD? Okay, we will do BDR. BDR is bronchodilator reversibility. Bronchodilator reversibility. So we will ask the patient, say for take an example. So we have performed FEV1 by FVC, or we have performed this spirometry, and you check your FEV1 by FVC report, and you see FEV1 by FVC is, say for example, 60%. I don't know what report in your report is, right? So say for example it is 60%. Okay, that means it is less than 80%. So you stamp it as obstructive, right? So you stamp it as obstructive. Now we need to determine whether it is COPD or bronchial asthma. Okay, whether it is COPD or bronchial asthma. So how to perform this? We will do a bronchodilator reversibility test, right? We will do a bronchodilator reversibility test. So how to do bronchodilator reversibility test? We will ask the patient to take a puff of this inhaler, 2 puff of this inhaler, 1, 2 puff of this inhaler, and wait for 15 minutes, right? And wait for 15 minutes. Okay, wait for 15 minutes, and after 15 minutes we will perform this test again, right? And we will look for the improvement in FEV1. Okay, we will look for the improvement in FEV1. We can also look FEV1 by FVC as well. Okay, but very commonly we look for FEV1, and we look for the increment in percentage increment in FEV1. Say for example FEV1 पहले जो था, अभी हम लोग जो एग्जांपल दे रहे हैं उसमें FEV1 by FVC कंसीडर कर रहे हैं, राइट? सो FEV1 by FVC is 60% in our example, so it is obstructive, right? Now after this inhalation, after 15 minutes, you see that new FEV1 by FVC is 75%. Say for example 75%. So the increment is 15%, right? Okay, आपका report मत देखो because I don't know what your report is, right? So in our example it is 60% pre-medication and post-medication is 75%. So the increment is 75%. Okay, so there is significant improvement. What is the definition of significant improvement? More than is equal to 12% improvement. More than is equal to 12% improvement. Okay, in our case it is 15% improvement. So it will go in favor of bronchial asthma. Okay, what is the purpose of this drug? What is the purpose of this drug, salbutamol or aspirin? What is the purpose of this drug? This drug is bronchodilator. Okay, this drug is bronchodilator. How? It relaxes the bronchial smooth muscles. Okay, and this is the only mechanism of obstruction in bronchial asthma. In bronchial asthma, the mechanism of obstruction is smooth muscle contraction. Smooth muscle contraction is jonno bronchial asthma hoy, right? But in COPD mechanism is different. In case of chronic bronchitis, there is nothing to do with smooth muscle, right? There is hypersecretion. आपको secretion stop करना पड़ेगा तब जाके relief होगा, right? Right? And in case of emphysema, there is destruction of the alveolar septa. Okay, there is destruction emphysema. There is destruction of the alveolar septa. It may be panacinar, it may be centriacinar. but ultimately there is destruction of the alveolar septa. Okay, there is destruction of alveolar septa. This is the mechanism here in emphysema. Okay, so आप जितना भी bronchodilator दे दो, there will not be relief, there will not be any increment. You cannot expect any increment or significant improvement, more than 12% increment. But in bronchial asthma, it is exclusively the obstruction in the airways is exclusively due to smooth muscle contraction. And if you do a reverse, मतलब smooth muscle contraction को आप reverse करके smooth muscle relax कर दो, the relief, the patient will have relief, right? And also there will be improvement in the report, right? FEV1 will increase, FEV1 by FBC will increase, and by more than 12%, it is significant improvement. So you call it reversible, right? Okay, so COPD patient को आप ये दे दो, there will be either there will be no improvement or there will not be any significant improvement. Say for example, in our example, it was 60% initially pre-medication, and after this puff, after 15 minutes, you check again, it is 65%. So hardly there is 5% improvement. This is not significant improvement because less than 12%, right? This is not significant improvement. So this will not go in favor of bronchial asthma. We will call it COPD. Clear? So this is how we differentiate between bronchial asthma and COPD, right? Okay. Now next is after seeing FEV1 by FBC, we check that it is less than 80%. Okay, we check it is less than 80%. So obstructive, right? And if it is more than 80%, that means it is either restrictive or normal. Okay. Now can you differentiate with the parameters whether it is restrictive or normal? Don't see your report because अब मुझे नहीं पता कि आपके रिपोर्ट में क्या है, patient का क्या है, right? Okay, and in patient mostly there are mixed disorders, obstruction, restriction, but for your examination purpose, you will be having hello, don't talk yourself, among yourself, okay? Okay, so after the class you discuss, no problem. Okay, so if it is more than 80%, FEV1 by FBC is more than 80%, right? It is either normal or restriction, but we don't know whether it is restriction or normal. Okay, so if you check all these parameters, again still we don't know, we cannot differentiate between restriction or normal. Okay, so the next thing what we need to focus on is the flow volume loop. Okay, what we need to focus on is the flow volume loop. So this is the flow volume loop. Okay, on the top left side you have the flow volume loop. This is the flow volume loop. Okay, on the x-axis there is volume and the y-axis there is flow. Okay, on the x-axis there is volume in terms of liters. Okay, and on y-axis we have flow. Okay, in the unit of liters per second. Okay, now someone give me your copy. Yes. Okay, so I'm drawing a flow volume loop. I'm drawing a flow volume loop for you, right? Okay, so this is the flow volume loop, right? This is not the flow volume loop, no, the axis. Okay, so y-axis we have flow in terms of liters per second. Okay, so what will happen if I blow within this device? Okay, if I blow within this device, there will be positive graph upper, right? And if I suck air from the machine, so there will be negative graph, right, in this side. Okay, so this is the RMS software. I am going to the calibrate transducer. Now if I blow inside, see this. Okay, is it measuring my volume? The volume I am expiring into it. Okay, stopping it. Okay, so this is the axis for flow volume loop, right? Now say for example I am expiring all the air. Okay, I am expiring or breathing out all the air from my lung. Now I am at what volume? Residual volume. So this is residual volume. I will start from here. Okay, now from residual volume, the device is in my mouth, right? And my nose will be clipped so that no air enters through my nose, right? Okay, So the device is into my mouth, right? And I am at residual volume. Okay, I am at residual volume. So check the x axis. So I am starting 1 from here. 1, 2, 3, 4, 5, 6, 7, 8, 9 liters. Okay, so my residual volume, say for example 1 liter. So I will start from here, and I will take all the air in. Okay, I will suck air from the device. Okay, so it will move like this from 1 liter to, say for example, 6 liter. Okay, so this is my inspiration curve. Okay, 1 liter to 6 liter. So from down residual volume, I am taking all the air in. Now my volume is TLC, total lung capacity, 6 liter. Okay, my inspiration curve is complete, right? Now with the device attached, I will again blow out all the air and I will again come to, so RV से मैंने TLC में आ गया, right? RV से मैंने TLC में आ गया, right? Now TLC से मुझे फिर RV में जाना है, ठीक है? So I will exhale all the air into the machine. Okay, so I will get an expiratory curve, and as during inspiration from RV to TLC, I am sucking air from the machine, so it is a negative curve, right? It is a negative curve, right? Negative curve. Now from TLC to RV, I will get a positive curve, right? And this positive curve is not as same as that of inspiration curve, and this is our most constant. ये देख के आपको diagnosis करना पड़ेगा in most of the cases. The expiratory curve, okay, and the expiratory curve, it looks like this. Okay, expiratory curve, it looks like this, not like the inspiratory curve, a roundish curve, right? It has a peak, right? It has a peak. Okay, so if I draw the y-axis as well, okay, so see the expiratory curve, right? See the expiratory curve. Do not try to interpret the report. It will be difficult for you now. Okay. So this is flow rate, right? This is flow rate, liters per second. At what rate I am exhaling? Okay. So 1 liter per second, 2 liter per second, 3 liter per second. So this is my peak expiratory flow rate, or PEFR. Okay. So it is around 9 liter per second. Okay. So at a rate of 9 liter per second, maximum rate is 9 liter per second. Then it is decreasing again, right? Okay. So you see, before the peak we have one part, and after the peak we have another part. Okay. So before the peak, it is called effort dependent part. Okay. Effort dependent part. Before before the peak expiratory, from total lung capacity, where your flow rate is 0 to the peak expiratory flow rate. Okay, 0 to peak expiratory flow rate, this part is called effort dependent part of expiratory curve. Okay, and this part is called effort independent part of expiratory curve, right? Effort dependent part and effort independent part. What does that mean? It means that, say for example, my total lung capacity was 6 liters. Okay, in this example, say for example, this is my flow volume loop, right? So my total lung capacity was 6 liter. Okay, from 6 liter मुझे कहाँ जाना है? Residual volume में. 6 liter से फिर residual volume में जाना है, right? So 6 liter to 1 liter. So I need to exhale total how much amount of air? 5 liter. Okay, 6 liter was my TLC. Now I will go to RV. Okay, 6 liter to 1 liter. So 5 liter I need to exhale. Okay. So I will do a forceful expiration so that all air निकल जाए, right? So that all air निकल जाए and it will be ultimately residual volume. So I will do a forceful expiration. Okay. So suppose say for example ये करने में मुझे 5 सेकंड टाइम लगा, ठीक है? 5 सेकंड I need for this maneuver, total maneuver. Okay. So initially the flow rate is high and gradually the flow rate is decreasing. Okay. So during the effort dependent part, my flow rate is increasing, that depends on the power of my respiratory muscles. Okay, my diaphragm, my external intercostal. Okay, the more force I will apply, the more will be the peak expiratory flow rate. So ये आपकी effort के ऊपर depend करता है. Now once you reach the peak expiratory flow rate, maximum force आपने लगा दिया and you are reaching the peak expiratory flow rate, इसके बाद भी कुछ air निकल रहा है, right? Okay. but that is not under your control. Okay, ये आपके control में है, right? The first part of expiratory curve, which is called effort dependent part, is on your control, right? The second part or effort independent part, it is not on your control. It depends on the patency of your airways, right? তোমার airway কতটা healthy আছে, right? It depends on the patency of your airways. তোমার airway নিজে করে দেখতে পারিস, খুব জোরে ব্লো করে একদম পুরো টোটাল লাং ক্যাপাসিটিতে যাবি, তারপরে পুরোটা ব্লো করবি, দেখবি শুরুতে যতটা ব্লো করলি সেটা তোর কন্ট্রোলে, তারপরে যেটা বেরোচ্ছে দিস ইজ নট আন্ডার ইউর কন্ট্রোল, ঠিক আছে? ওকে, সো দেয়ার ইজ এফোর্ট ডিপেন্ডেন্ট পার্ট অ্যান্ড এফোর্ট ইন্ডিপেন্ডেন্ট পার্ট। ওকে, লাস্টের দিকে যে এয়ারটা বেরোচ্ছে দ্যাট ইজ নট ইন ইউর কন্ট্রোল, ইট ডিপেন্ডস অন দি পেটেন্সি অফ ইউর এয়ারওয়েজ, তোমার এয়ারওয়ে কতটা হেলদি আছে, ঠিক আছে? এয়ারওয়ে কতটা হেলদি আছে, তো সেটা হচ্ছে এই পার্টটা, এফোর্ট ইন্ডিপেন্ডেন্ট পার্টটা। ওকে, তাহলে এই এফোর্ট ইন্ডিপেন্ডেंट पार्टটা যেটা, दिस इज आवर मोस्ट कंसर्न एंड ये देख के आपको डायग्नोसिस करना है फॉर डिफरेंट डिजीजेस। ओके, सो से फॉर एग्जांपल এটা নরমাল, আমি এটা নরমাল কার্ভ, ওকে, যেটা আমি ব্লু কালারে এঁকেছি, আমাকে আরেকটা কালার দে সামওয়ান, ব্ল্যাক বা রেড, ঠিক আছে? ওকে, এটা নরমাল কার্ভ, আমি আরেকটা কার্ভ আঁকছি, রাইট? এটা তো ব্লু রে, কি রে? ওকে, আমি আরেকটা কার্ভ আঁকলাম, ঠিক আছে? সো ব্লু ওয়ান ইজ দি নর্মাল ফ্লো ভলিউম লুপ। ওকে, blue one is the normal flow volume loop, right? Blue one is the normal flow volume loop and the red one is the abnormal flow volume loop. So what do you find? What are the features in the abnormal flow volume loop? What are the features in the question is what is the, যদি এই কোশ্চেনটাই দেওয়া হয়, এই কোশ্চেনটাই যদি এক্সামে দেওয়া হয়, রাইট? সো হাউ উইল ইউ রেসপন্ড? ওকে, এই কোশ্চেনটাই যদি এক্সামে দেওয়া হয়, হাউ উইল ইউ রেসপন্ড? Okay, one point, TLC has decreased, right? TLC has decreased, TLC increase করেছে তো এখান থেকে 1 2 3 4 5 6, তাহলে এইখানে TLC আমার, ঠিক আছে? আমার TLC ছিল 6 লিটার, এখানে দেখাচ্ছে 8, ঠিক আছে? 7 পয়েন্ট সামথিং লিটার। ওকে, তাহলে TLC ইনক্রিজ করেছে। ওকে, তাহলে ফার্স্ট ফিচার, ও রাইট, একটা একটা করে, ঠিক আছে? ওকে, সো ফার্স্ট ফিচার ইজ TLC ইনক্রিজ করেছে, রাইট? ফার্স্ট ফিচার। সেকেন্ড ফিচার RVO ইনক্রিজ করেছে, রাইট? RVO ইনক্রিজ করেছে। আর কি ফিচার্স আছে? 5টা ফিচার্স বলতে হবে, देयर आर 5 ফিচার্স। ওকে, TLC ইনক্রিজ করেছে, RV ইনক্রিজ করেছে, আর কি? ইয়েস, পিক টোটাল, নট টোটাল ফ্লো, হোয়াট ফ্লো? পিক ফ্লো। পিক ফ্লো আমার ছিল এখানে 9 লিটার, ঠিক আছে? 9 লিটার, এখানে কত হচ্ছে? 6 এর কাছাকাছি, 5 পয়েন্ট সামথিং, ঠিক আছে? তাহলে পিক ফ্লো কমে গেছে, তাহলে রিডিউসড PEFR। আর কি হয়েছে? ইয়েস, there is a shape problem in the effort independent part, ঠিক আছে? effort independent পার্টটা কনকেভিটি হয়ে গেছে, ঠিক আছে? এটাকে আমরা কি বলি? দিস ইজ কল্ড স্কুপিং। আইসক্রিম স্কুপ দেখেছো? সো এই পার্টটা স্কুপিং হয়ে গেছে, রাইট? তাহলে স্কুপিং অফ, পুরো কথাটা লিখতে হবে, ঠিক আছে? তাহলে ফিচারটা কি আছে? স্কুপিং অফ এফোর্ট ইন্ডিপেন্ডেন্ট পার্ট ইন দি এক্সপিরেটরি কার্ভ। ওকে, তাহলে স্কুপিং অফ এফোর্ট ইন্ডিপেন্ডেন্ট পার্ট অফ দি এক্সপিরেটরি কার্ভ। 4টা ফিচার হলো, আরেকটা ফিচার বাকি আছে কি? টোটাল কার্ভটা লেফটে শিফট করেছে, ঠিক আছে? তাহলে লেফট শিফট, ঠিক আছে? দিস ইজ ডায়াগনস্টিক অফ অবস্ট্রাকশন। তো বটেই, এখানে কোন ডিজিজ সেটাও বলা যাচ্ছে, কি ডিজিজ বলা যাচ্ছে? অবস্ট্রাকশন তো ডেফিনেটলি। দিস ইজ এমফাইসেমা, ঠিক আছে? কেন এমফাইসেমা? এমফাইসেমাতে কি হয়? অনেক অ্যালভিওলি থাকে, তো ছোট 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 অনেক অ্যালভিওলি থাকে। এবার মানে দুটো ঘর মনে কর, এই ঘরটা আর তোদের পাশের ডেমো রুমটা, ঠিক আছে? দুটো অ্যালভিওলি, এটা একটা অ্যালভিওলি আর পাশের ডেমো রুমটা একটা অ্যালভিওলি, ঠিক আছে। এটা হচ্ছে কমন ওয়াল, দুটো অ্যালভিওলি, ঠিক আছে, কমন ওয়াল। এবার এমফাইসেমাতে কি হয়, কমন ওয়াল ইজ গন, ঠিক আছে, কমন ওয়াল ইজ গন, রাইট, একটাই বড় অ্যালভিওলি হয়ে গেছে, এটাই তো এমফাইসেমা, রাইট। তাহলে কি হবে, ভলিউম অনেক বেড়ে যাবে, ঠিক আছে, হ্যাঁ ভলিউম অনেক বেড়ে যাবে, ঠিক আছে। কমন ওয়াল ডিস্ট্রয় হয়ে গেলে আলটিমেটলি ভলিউম অনেক বেড়ে যায়, আমার রেসিডুয়াল ভলিউমও বাড়বে, টোটাল লাং ক্যাপাসিটিও বাড়বে, সেটা বেড়েছে, সেই জন্যই আমার লেফট শিফট হয়েছে, ঠিক আছে, সেই জন্যই লেফট শিফট হয়েছে, ওকে। আর স্কুপিং যদি থাকে তাহলে আমাদের ফ্লো ভলিউম লুপ দেখতে হবে। ফ্লো ভলিউম লুপে যদি স্কুপিং থাকে, ইফ দেয়ার ইজ স্কুপিং, অবস্ট্রাকশন, ঠিক আছে। যেমন অবস্ট্রাকশন তুমি দুটোভাবে দেখতে পারো, এক হচ্ছে FEV1/FBC, দেখো লেস দ্যান 80% স্ট্যাম্প অবস্ট্রাকশন। তুমি ফ্লো ভলিউম, তোমাকে FEV1/FBC আমি দেখতে দিলাম না, ঢেকে রেখে দিলাম, ঠিক আছে, FEV1/FBC দেখতে দিলাম না পরীক্ষায়, লুপ, ঠিক আছে, ফ্লো ভলিউম লুপ দেখালাম, ফ্লো ভলিউম লুপ দেখে তুমি দেখলে এরকম স্কুপিং আছে, অবস্ট্রাকশন, ঠিক আছে। এরপরে অবস্ট্রাকশনের মধ্যে সেটা ব্রঙ্কিয়াল অ্যাজমা না এমফাইসেমা, সেটা দেখার জন্য তোমাকে দেখতে হবে শিফট হয়েছে কিনা, ঠিক আছে। যদি লেফট শিফট হয়, আরভি টিএলসি দুটোই বেড়ে যায়, এমফাইসেমা, ঠিক আছে। ব্রঙ্কিয়াল অ্যাজমাতে তো সেপ্টার কোনো প্রবলেম হয় না, কমন ওয়ালের কোনো প্রবলেম হয় না, তাহলে ভলিউমের খুব একটা চেঞ্জ হওয়ার কথা নয়, না আরভি চেঞ্জ হবে না টিএলসি চেঞ্জ হবে, রাইট, ইন ব্রঙ্কিয়াল অ্যাজমা। তাহলে ব্রঙ্কিয়াল অ্যাজমাতে কি হবে, এই যে নর্মাল কাপটা এখানেই স্কুপিং হয়ে যাবে, রাইট, এখানেই স্কুপিং হয়ে যাবে, দেয়ার উইল নট বি এনি শিফট, ওকে। পিক এক্সপিরেটরি ফ্লো রেট কমতে পারে, কিন্তু এখানেই মানে কার্ভের পজিশনটা চেঞ্জ হবে না, রাইট, হ্যাঁ লেফট শিফট হবে না, ওকে, ঠিক আছে। তাহলে আমি আরেকটা কার্ভ যদি আঁকি, ব্ল্যাক কালার আছে কারোর কাছে, ব্ল্যাকটা দেখ, black one is also obstruction, there is scooping, there is reduced peak expiratory flow rate, RVTLC unchanged, but there is scooping in the effort independent part, right, so bronchial asthma, ঠিক আছে। ক্রনিক ব্রঙ্কাইটিসও হতে পারে, ঠিক আছে, ক্রনিক ব্রঙ্কাইটিসও হতে পারে, বাট at least not emphysema, ক্লিয়ার, বোঝা গেল, ওকে। তাহলে তোমাকে ডিফারেন্সিয়াল ডায়াগনোসিসটা লিখতে হবে, ওকে। তাহলে আমি যদি পরীক্ষায় এরকম একটা কার্ভ দিই যেখানে নর্মাল কার্ভটা দেওয়া আছে, অ্যাবনর্মাল কার্ভটা দেওয়া আছে, তাহলে অ্যাবনর্মাল কার্ভের আমার ফিচার্স দেখতে হবে, পিক এক্সপিরেটরি ফ্লো রেট দুটোতেই কমবে, ঠিক আছে, পিক এক্সপিরেটরি ফ্লো রেট যা ডিজিজই হোক কমবে, ঠিক আছে। স্কুপিং দেখলে অবস্ট্রাকশন, যদি শিফট হয়ে থাকে, লেফট শিফট হয়ে থাকে, যদি লেফট শিফট হয়ে থাকে তাহলে ইট উইল গো ইন ফেভার অফ এমফাইসেমা, ঠিক আছে। তাহলে তুই লিখবি প্রভিশনাল ডায়াগনোসিস এমফাইসেমা, প্রভিশনাল, এটা থেকে তুই একদম 100% বলতে পারছিস না, এরপরে তোকে সিটি স্ক্যান করার আছে, এক্স রে করার আছে, অনেক কিছু আছে, ওকে, আচ্ছা, ঠিক আছে। তাহলে ইট উইল গো ইন ফেভার অফ এমফাইসেমা যদি লেফট শিফট হয়ে থাকে, ওকে, আচ্ছা। তাহলে অবস্ট্রাকশনটা মোটামুটি বোঝা গেল, ওকে। এবার যদি রেস্ট্রিকশন হয় কার্ভটা কিরকম হবে, রাইট শিফট হবে, তাই, আচ্ছা, রাইট, এইটা নর্মাল কার্ভ, ঠিক আছে, এইটা নর্মাল কার্ভ। এবার রেস্ট্রিকশনও তো একরকম হয় না, রেস্ট্রিকশনের মধ্যে কি কি আছে, ইন্ট্রা প্যারেনকাইমাল রেস্ট্রিকশন, এক্সট্রা প্যারেনকাইমাল রেস্ট্রিকশন, ঠিক আছে। ফাইব্রোসিস ডিক্রিজ করেছে, টিএলসিও ডিক্রিজ করেছে, আরভি টিএলসি দুটোই ডিক্রিজ করেছে, তাহলে